Hello my nursing stars, how are you all today? My name is Muhammad Yasin Ahmed. I am the administrator of RN Coaching. This is a Facebook group and now recently I started this YouTube channel. I have different other videos, but this is officially something that I'm starting today. Is a long journey that you will all be taking with me. So basically what happened is a lot of people asked for content review, and I wanted to create something which is in-depth and total. When somebody reads a content, they have to know everything about a specific disease. So I created a review, I completed it, and I have posted it on my Facebook group, RN Coaching, which has 35 units, and it's a PowerPoint workbooks, and the slides basically have this same concept. It states the disease, and then it states all of these sub categories. What are the causes, assessments, diagnostic tests, nursing diagnosis, what are the treatments, what is the drug therapy for it, what are the interventions and teachings. So the first unit is cardiovascular system, and this is the adult portion of it. So it has 10 units. This unit has 19 slides, and this is the first slide, and which means that I have to make a lot of videos, and I have to post them. So hopefully I'll be able to accomplish this for you all. So let's start with abdominal aortic aneurysm and find out what this is all about. Okay, so abdominal aortic aneurysm. This results from the damage to the medial layer of the abdominal portion of the aorta. It commonly results from atherosclerosis, which over time causes the weakening in the medial layer of the artery. And continued weakening from the force of the blood flow, it results in the outpouching of the artery and formation of an aneurysm. Okay? So when an aneurysm is formed, basically, if you see a tire, most of you might be driving. I know most of you might have cars. You might see a bubble in your car. It's just like that. You might see a bubble on the aorta. Okay. So what happens when it ruptures? Three things happen when it ruptures: hemorrhage, which is bleeding, internal bleeding, hypovolemic shock, and death. Now, you have to know this, what happens when an aneurysm ruptures: hemorrhage, hypovolemic shock, and death. There are also types of aneurysms, and there are 4 types: dissecting, false, fusiform, and saccular. I can go in detail, but this video is going to become too long. So I want you to find out what all 4 of these are and how are they different from each other. Okay? Now let's see some causes of abdominal aortic aneurysm. Some causes of abdominal aortic aneurysm are atherosclerosis, congenital defect, hypertension, infection, Marfan syndrome, syphilis, and trauma. Okay? So let me repeat that one more time. Atherosclerosis, congenital defect, hypertension, infection, Marfan syndrome, syphilis, and trauma. Now, most of the people that I have seen that have this is they have a history of hypertension, and they have a history of atherosclerosis. I have never came across anybody with Marfan syndrome or syphilis or trauma. I have not seen in my nursing career. I'm also a new nurse, so I might come across later in my life, but as of now I have not seen this. What are the assessments for abdominal aortic aneurysm? Some of the assessments for abdominal aortic aneurysm are abdominal mass to the left of the midline, abdominal pulsations, abdominal mass, bruit over the site of aneurysm. One more thing about abdominal aortic aneurysm is, I have written it on the top, it is asymptomatic. Okay? Asymptomatic. What is, many people, sometimes we read stuff but we don't know what it is. So I want it to be as clear as possible. So asymptomatic means producing and showing no symptoms of any kind. Okay? So you might have it but you have no idea. So that's why it says you have to go for physical checkups and all. As a nurse, it's very important when you assess, make sure that you listen to their sounds, make sure that you listen to the bruits, if they have any bruits. So it is commonly asymptomatic, and the other assessment findings are lower abdominal and back pain, diminished femoral pulses, and systolic low blood pressure in the legs than arms. Okay? So the assessments, we will go over the assessments one more time. Abdominal mass to the left of the midline, abdominal pulsations, abdominal mass, bruit over the site of aneurysm, and it is commonly asymptomatic, lower abdominal and back pain, diminished femoral pulses, systolic systolic BP low in the legs than arms. Okay? What are some of the diagnostic tests for abdominal aneurysm? The diagnostic tests for abdominal aneurysm are abdominal CAT scan showing aneurysm, abdominal ultrasound, arteriography shows aneurysm, chest x-rays show aneurysm, and the ECG differentiates aneurysm from MI. Okay? What are some other nursing diagnoses? Acute pain, anxiety, ineffective tissue perfusion, risk for deficient fluid volume. You have to know all of this. I know it's hard, it's a lot of material, but try to understand each topic. Take it slowly. Understand what the concept is about. What I'm trying to do here is give you the whole picture of something. Okay? So don't get overwhelmed with it. What are the treatments for abdominal aneurysm? What are the possibilities that are available to resolve this issue? The first one would be abdominal aortic aneurysm resection surgery, which resolves the issue, and after the surgery, bed rest. Okay? Drug therapy is there. I will tell you the drug therapy, we have to treat first the pain, for which we have to give analgesics. Some of the analgesics are oxycodone or oxycontin. Okay? We also have to, so I told you earlier that some of the patients that I have seen that have abdominal aortic aneurysm, they have also hypertension. So usually there are these antihypertensive medications are also given, prazosin, nitroprusside, and nitroglycerin. And there are also some of the other drugs that are given are beta adrenergic blockers, propranolol and metoprolol. Okay, that is the drug therapy. Now, what are the interventions for abdominal aortic aneurysm? Observe the client for signs of hypovolemic shock for aneurysm rupture. Signs such as anxiety, restlessness, severe back pain, decreased pulse, pale, cool, moist, clammy skin, to detect early signs of any compromise. Gently palpate abdomen for distension. Increasing deformities may signify impending rupture. Check peripheral circulation. Assess pain to detect enlarging of the aneurysm. Administer meds for pain and hypertension. Encourage clients to express feelings. Most people are afraid of dying because they think something is really wrong in their body. So you have to you have to encourage them to express any feelings and teach them what is going to happen with them. Maintain quiet environment to control hypertension and anxiety. And lastly, the teachings of for this disease. Explanation of the disorder and the teaching plan. Medication management, especially possible side effects of the medications they are on. Signs and symptoms of decreased perfusion, you have to let them know if they see any signs and symptoms of any decreased perfusion. Activity limitations, if they have if the doctor suggests in their notes for any activity limitations. And you also have to teach them to adhere them to their diet and exercise regimen. So that is the last topic of that is the last section, teaching. So yes, it is a lot of information, and but once you start doing them, once you make a habit of learning the content with this style, you will get a lot of info. And when you know all of this info, somewhere in the back of your head, you will be able to, when you read select all of the apply question, you will be able to pick it right. And if you don't know something, you cannot answer. You have to be 100% sure. So at least if you skim through this, you will get a general idea. And once you read the question, you will have, no, I have read somewhere, I have read this, and I think this is the answer to it. So alright, so this is the first slide. We're done with the first slide, abdominal aortic aneurysm. I hope you liked my video. Subscribe to RN Coaching, and thank you very much. You will be seeing me more. I will come up with the next one, which is angina. Thank you.